coming together of world leaders at the Millennium Development Goals Summit in New York provided the platform for countries and stakeholders to present and review the various progresses recorded in the Global Millennium Development Goals target. The meeting also offered the opportunity to identify the gaps and commit to concrete steps to reach the 8 anti-poverty goals agreed to at the Millennium Development Summit in 2000. Today, Africa's most populous country with a population of 140 million people has, after 10 years of the United Nations Declaration at the Millennium Summit, performed wonderfully in all the 8 Millennium Development Goals. In Nigeria, the Office of the Senior Special Assistant to the President on MDGs has paid particular attention to the 8 goals. However, much attention has been given to the critical areas of concern in the country. Presently, women of childbearing age constitute 31 million of the number of population, while children less than 5 years of age makes up 28 million of the overall population. It is in these two big areas that Nigeria's government and the Office of the Senior Special Assistant to the President on MDGs have in the past years paid particular attention. The health needs of the people of Nigeria with special focus on women and children.
The progress we are recording now includes what we are doing on maternal health. Like we said, we recorded 32% decrease in maternal mortality just between 2003 and 2008. Certainly if we got the current data, that would have gone down much more. But of course, maternal mortality ratio of 545 is still very high. But like we said, if you disaggregate the data, you find that in a place like Lagos, it's sub 200, they are recording just a little over 100. But when you aggregate data, you have this problem. So what we've done is a major intervention. We are now putting midwives right where they are needed in the communities.
Although there has been massive progress in all the MDG goals in Nigeria, health still remains a big challenge. Maternal and child mortality has remained high in Nigeria despite several efforts that have been aimed at reducing the incidences. It is estimated that Nigeria, which constitutes just 1% of the world's population, accounts for 10% of the world's maternal and under 5 mortality rates. Annually, an estimated 52,000 Nigerian women die from pregnancy-related complications. This accounts for 10% of the 529,000 global maternal deaths. These statistics raise concern that led to the international community putting health at the center of the Millennium Development Goals.
The number of women that are dying in childbirth has reduced. It's dropped about 30-35%. Not sufficient. 545 women dying per 100,000 is still a large number of women. And we need to make sure that that figure crashes. And this is where the President had said before we came, set up a special task force where the Vice President is chairing it to address it. At this meeting, we hope to show people the strategies we used. The 2,400 midwives that we put into the system, how we address the primary health care referral system, what we're doing about community health extension workers, and from that see what kind of traction we can get from our partners in, first of all, meeting the commitments, but secondly, encouraging those that were skeptical and cynical about spending and investing in Nigeria, that here's debt relief. We spent it well, it's made an impact, and you can measure it.
The office of the SSAP has, despite these challenges, made huge strides to improve the lives of Nigerian people. Nigeria revealed at the Millennium Development Goals Summit that, with funding from its office and supplemental funding from the state secured through a Memorandum of Understanding, 2,488 midwives have been posted to 652 primary health care centers in rural areas across the country. The emergence of MDGs has given the health sector in Nigeria a facelift. Immunization against the main killer diseases, tetanus, measles, and polio, have proven to be one of the most cost-effective interventions for reducing childhood illness and death in Nigeria.
On polio, we're doing well. 99% interruption of transmission. Since the beginning of this year, only 7 cases. We are surely on the road to getting it eradicated. The same thing with guinea worm. 20 months, no single case of guinea worm in Nigeria. So these are important developments. But I think what is more important now is that we are beginning to strengthen the health system.
Some of those success stories are, for instance, polio. We've got a 99% success rate, but that success will not be sustained unless we invest more in routine immunization, which means that we have to put that to work at the primary health care level.
The Office of the Senior Special Assistant to the President on MDGs revealed at the summit that improving the health of the nation and delivering progress towards the health-related MDG targets required efforts by various actors working in a more collaborative manner. As the efforts towards making changes in the country intensifies, the MDG's office believes interventions would propel Nigeria in making progress towards the health-related MDG target by 2015.